Research shows that more than 1/3 of adults in the United States are considered to be obese.
We have Katerina Chryssafis in Studio B talking about the persuasive messages that we can send to help combat this issue.
Hello, and thanks so much for joining us. I have the pleasure of speaking with Assistant Professor Dave Keating. Thank you for being here.
Very welcome.
So can you tell us a little bit about what you do and what you specialize in terms of healthcare research?
Yeah, for the last 6 years, probably a little bit more, most of my work has been in health communication. And that means a lot of different things depending on who you're talking to. But for me, what that means is persuasive message design. So how do we design messages that are going to be most effective in convincing people to do things that we think are good for them and to believe things that are going to result in healthy behaviors and healthy lifestyle choices?
Okay, that's great. And how exactly do you implement that? Because I did a little bit of my own research, and correct me if I'm wrong, but according to the National Institute of Diabetes and Digestive and Kidney Disease, more than 2 in 3 adults are considered to be overweight or obese. And in addition, more than 1 in 6 children suffer from this as well. Why do you think that this problem still persists, and what are ways that you can send out those persuasive messages in order to implement change?
Right. So one of the big challenges for people like me who are interested in this area, and really for government agencies both at the federal and state level, local level, is how to not just convince people, but how to also give them the tools to engage in those healthy behaviors, engage in that healthy lifestyle. When the type of research that I have conducted in the past, for instance, I worked in Washington, D.C. at a private research company, and the D.C. Department of Health was curious about how to get people to be more active, to get out there and exercise for at least a little bit each day. And the reality is people who are overweight, obese, adults, I'm speaking about adults in particular, they tend to know that they are overweight and obese. They tend to understand that it's not good in terms of their health to be that way. And the messages you put out there, it's resonating with them. But the challenge doesn't come from the messaging or the motivation necessarily. It comes from, I am working 2 jobs. And when I get home, I don't have time to cook for my kids before I have to put them to bed. So McDonald's it is today. I mean, that's a very real reality.
Another thing that I kind of looked up on my own was I saw that the World Health Organization said that the world is kind of divided between people who don't get enough to eat and people who eat too much. Do you agree with that? And do you also think that this is something that varies from country to country? Like, is this an American problem, or is this something that we can see going on all over the world?
Now, admittedly, obesity and overweight, that is not something that I have an abundance of experience in. But to get at your question, which is this something that is probably happening, and is this something that varies by country? I mean, definitely. I think, there's that joke that 1 in 5 Americans is hungry, and the other, 3 of the remaining 5 or 3 of the remaining 4 eat too much. I mean, it's a very real, it's something to think about, and the question comes in, how do you address both of those needs? So how do you give people who are not food secure the type of resources? Like, for instance, CSUN has the food pantry that they just implement, which is a great resource. But then on the other side of things, how do you convince people not to maybe eat as much, or to cut back on the foods that are not good for them?
Absolutely, and I think it's important that they're aware of these resources, and I'm sure there's plenty of information online and so forth. But unfortunately, we do have to end our interview today, but thank you so much for joining us again, and look forward to hearing more from you and seeing more research in the future.
Thank you very much.
Thank you. Back to you guys.